So if we just move to the next slide, my name is Avril Daly. I'm the CEO of Retina International, and that's a patient-led global organization. We have members all over the world, including in Europe, who are themselves organizations who've been funding and supporting research into retinal degenerations for over 50 years now, particularly in the area of gene and cell therapy. So as you can imagine, we would have started working on gene therapy, in the 1970s when very little was known. To get to this stage now is a critical time and a very hopeful time for us, but it's not without challenges. So really what I wanted to talk to you about today was, just the basics really of, genetic disease and, what the challenges are for us on the ground and how we may need to look at how we assess value and also what policy actions can support us in our efforts. So as you will all know, in Europe, a rare disease constitutes fewer than 1 in 2,000 citizens. And some will say there are about 6,000 rare diseases. Others would say there are about 10,000 rare diseases. Of course, they're being described every day. But we understand that there are 30 million people in Europe who are affected by a rare disease. We must recognize that within the context of that, about 80% of rare diseases are genetic in origin. So we must understand that that's a huge portion, and that the onset generally occurs in childhood, with about 50% of rare diseases, causing mortality, unfortunately, in children. So the main groups that you would be familiar with in the context of rare disease are the metabolic, neuromuscular, I should say, autoimmune. We have developmental anomalies, bleeding disorders, cardiovascular, respiratory disease, skin disease, rare cancers, and also sensory diseases, which my organization would be involved with. But it's very important to consider, and it's already been mentioned this morning, that we're learning more and more about general diseases or common diseases, and that some of them actually are inherited and have that genetic component. So it's really looking into the future. It's much broader than just the rare disease space. So next slide, please. So how do we address the challenges in Europe through gene therapy? So gene and cell therapy has huge potential, as we've already said, to treat inherited and complex conditions and to change the lives of a very significant number of people with a very challenging unmet need, and to reduce the burden of disease on those patients and carers. A survey from a Rare Barometer study survey from Eurordis a couple of years ago showed that people who are caring for patients living with rare diseases and the patients themselves spend about 6 hours a day just on administering therapies and treatments and various different caring for people with the disease. So that's a significant amount of time, as you can imagine. And so if we can improve the delivery of care and treatment with genetic disease, we can really reduce burden. We can reduce disease burden on those that are affected, and the burden of treatment, which can be very complex and can take a lot of time, as I've already said, but also, the actual burden on those HCPs who are delivering the care. And we can also address growing societal inequalities. People who are living with rare diseases are often marginalized and lost within the system, and can, have all of the realities that affect you in those circumstances. And ultimately, we do believe that gene therapy and cell therapies can reduce cost because of their personalized nature. And we've heard a lot about that already. So next slide, please. So the key challenges, as I've already said, from our perspective, these are just key challenges. We've heard about the issues concerning pricing, reimbursement, and access. But from our perspective, it's an infrastructure issue. It's an issue of how we assess value. And it's also an issue of policy action and how we can join the dots on the various policy actions on this issue and what's relevant to this issue. So next slide, please. So a lack of infrastructure to support the delivery of genetic services is a real challenge for us right now. When you receive a genetic diagnosis, it's a fundamental step on your journey as a patient. And we know this. We know there are huge challenges with diagnosis in the rare disease community. We know and are learning more about newborn screening. Genetic diagnosis is something that seems to slip through the cracks a little bit. And it's, of course, fundamental. If you're talking about delivering a gene therapy, you have to have a genetic test. So we need a best practice model in Europe on access to genetic testing and counseling services. In Retina International, we undertook a study last year to look at the processes of accessing a genetic test and then the patient experiences, which were in fact very different. If you look at it from a process perspective, it seems okay. But if you talk to the patients, then it's a very different reality. So our study found that with 419 respondents from patients living with IRDs, which are inherited retinal degenerations, and this 42% of respondents did not receive a genetic counseling prior to genetic testing, and 33.89% of respondents did not receive genetic counseling after receiving a genetic test. Now, why is that important? You need to understand what a genetic test is and its relevance to your family and its impact on you prior to agreeing to the test. It's a very complex and very important issue. And subsequently, to not have genetic counseling is handed data as a patient that is not interpreted. And it might alarm you, and it should alarm you to know that organizations such as ours receive this data from patients who don't know what to do with it. So you can imagine the challenges that we are facing because we don't have that sort of a support for this specific area. We really need to increase awareness and training within HCPs. We have a global shortage of genetic specialists. We have a global shortage of genetic counselors. We don't recognize genetic counseling as a medical discipline. And there's very little training. It's very sporadic in Europe. It's not very consistent and it's not available everywhere. And that's a challenge if we are to talk about delivery of gene therapy in the healthcare system. You know, it's the burden on the patient currently to navigate the system to find a genetic diagnosis. And really, we need to address this. And also how we assess value. I can only speak from the perspective of our community, which is a small community, a small population, where we're talking about inherited retinal degenerations. So if you're looking at health economics and you're looking at how a patient affects the healthcare system and as a cost to the healthcare system, well, we really don't fall into that group because vision loss is unlike other conditions where, you know, you don't go to see your doctor very often, you're not sick per se. And health systems costs are the lowest cost types when conducting socioeconomic analysis on the impact of vision loss of inherited retinal degenerations. We have done this in Europe and we have done this in the United States and Canada. And what we're learning is that what really affects this population are very high rates of depression, anxiety, mental health issues, huge financial stress. There's impact on access to education, on access to employment, and huge productivity losses. There is impact on the caregivers, and they're often missed in not just the community I represent, but in all rare diseases. The burden on caregivers is enormous. People have to leave work, you know, and they have to navigate a very complex system. And of course, there are many intangible costs that we don't assess when we are looking at the traditional HTA model. And I think this is a very important point that we must look at. We need to look at the person, the patient, and their families, and the entirety of the supports that they need, which may not necessarily be specific to healthcare. And that's important. And of course, this is also something that affects other rare diseases. It's not just our community that have this issue. So next slide, please. So we know that there is a lot being done in Europe, and you know, rare diseases have been a priority, a public health priority in Europe for many years. But the issue of genetics, you know, is something that, although fundamental in rare diseases, we probably don't discuss it enough. There are issues with that. And I think that affects how we act from a policy perspective. But there is a lot of good happening. You know, there's a lot of joined up thinking already. There's a lot of initiatives that can support access, that can really look at the landscape and try to address the gaps and the issues. And, you know, I've listed many things here that are related to to how we enact policy in Europe. What I think is very important, and we should say, is that when we are looking at the policy landscape, we need to consider, is it consistent? Is it aligned? Is one element of policy going to have a detrimental effect on the other? And I think this is very important as we look at this really hugely valuable and hugely encouraging and hopeful area of health. You know, sometimes this can be an unintended consequence, and it's something that we in the patient community are keeping a very close eye on. So next slide, please. So as I said, you know, the issue of genetics and you know, its impact on rare diseases and, as I say, other conditions is something that probably we don't speak enough about, and there is a lot of confusion about. So the roles of genetics in healthcare is often very unclear. It can often be considered as niche. Well, it's not niche. It's but it's a model of care. It's a model of delivery of care and personalized care and therapies into the future. It is seen as the future, but it's really now, as we know, and we've already heard, gene therapies are available and there are more to come. And under-resourced genetic services are a real impediment to access here. And we must include testing and counseling, and support them in the development, and their development in the context of the healthcare systems. And we also must consider, how we deal with that data, in the development of registers, is something that, is discussed a lot in this community. We must realize the full potential of innovation in gene and cell therapies. Gene and genomic strategies are needed to support the delivery of care and the alleviation of the care burden on patients, carers, and HCPs. And if you look across Europe, there's huge disparity here. There are some very good examples of gene and genomic strategies, but in other countries, there is no strategy whatsoever. And unfortunately, and in some countries as well, in Europe, genetics is not seen as a health discipline in and of itself. So how is it ever going to be catered for? We need to rise all boats. And, to my previous point, we can do that by enacting very robust policy actions in this space. And that's really very important. As I said, we need to be consistent. We need to support the delivery of these therapies. There is a lot to be discussed. We've heard from our previous speaker, on the issue of cost and access and reimbursement. And looking at a system for 21st century therapies is really important, because currently we're applying a 20th century model and a 20th century thought process to how we're going to deal with those. And that's really not going to work for us if we want Europe to be a leader in innovation, not only in the development of these therapies, but in how we deliver them and how we think about them and how we think forward into the new era of gene therapy. It's really important to know that we are talking about a transformation. But sometimes, and I know politicians get a little scared when they hear the word transformation, because it might mean a huge amount of cost. But really, we have the intellectual capital in Europe. We have a lot of these systems, and we are in the process of networking them together. And those networks, like the European reference networks, for example, offer huge hope, and they really need to be supported. And if they are supported, it will go a long way to ensuring that we have laid the groundwork for the future. And really, I think that's really what is important. Let's look at what we have, let's support what we have, and let's work together. Thank you.